My name is Dr. Bree Chancellor, and I'm a neurointerventionalist or interventional neurologist. I perform procedures on the vascular structures of the brain and spine to treat disorders such as aneurysms, strokes, arteriovenous malformations, and other lesions. I also perform diagnostic procedures to try to discover what's going on and what's the cause of a patient's symptoms, including cerebral angiogram. The main reason that I'm most interested in neurointerventional surgery is because it treats fascinating disorders of the brain and spine. And I found that these types of disorders are particularly interesting because of the mind-brain connection. And the other thing I really love about neuro-IR is that the technology that we get to use is quite beautiful and allows us to do very elegant procedures without a lot of invasivity through catheters. And we can create these beautiful images of vascular structures in the brain and treat very deadly disorders with low risk to patients and very high efficacy. One thing that differentiates me is the fact that I have training as a neurologist. So I look at the mind-brain connection in a little bit of a different way than a surgeon trained with pure neurosurgery. I also, of course, have the neuroradiology and neurosurgical training to perform neurointerventional procedures, but I think that I take a very holistic approach to my patients in thinking about them as individuals and how the vascular lesions that affect them affect their entire being in life. And I look at the way I care for patients as sort of a family unit. So I think first understanding your patients and where they're coming from is the basic step. And then, of course, targeting your language to what's important to them and their ability to understand those facts. So I think even with these very complicated situations in vascular neurosurgery, there's always an essence. What is the risk to the patient right now? What is the risk in the future? And what are the most likely outcomes? I spend a lot of time thinking about all of the details so that I understand it and take on that worry for them. And then I'm able to communicate more simply the essence of it and what that means to them and their future and their health.